Hello and welcome. My name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine physician. I specialize in injuries of the shoulder, elbow, and knee. And welcome to the Whiteboard series. Today we're going to talk a little bit about lateral and medial epicondylitis, also known as tennis elbow and golfer's elbow. And I would just want to go over what exactly it is and the appropriate way to use a counterforce brace or the type of brace that you would need for any of those tendinitises. This is a counterforce brace. All that this is a circumferential brace made of neoprene that actually gives you a little bit of tension across the irritated area. The way you use a counterforce brace is you find the area that's painful, if it's the outside of the elbow or the inside of the elbow, approximately 1 thumb's breadth below where it hurts, you're going to slide your brace. You're going to slide it all the way up, 1 finger breadth or 1 thumb's breadth below where it's irritated, and then you're going to wear it snugly. You use this throughout the day during your regular activities. Use it for a couple of weeks, see if you have an improvement in your symptoms. If it does help, then that may be all that you need to do, in addition to maybe taking an anti-inflammatory. Now, one thing that's key is make sure you do not have this too tight. If you have it too tight where you actually feel numbness, tingling in your hands, or you see some discoloration, that means it's too tight and you want to loosen it up a little bit. This is supposed to be comfortable. And just be aware of what you're doing repetitively during the day. Make sure you're not repetitively using that wrist or lifting that wrist or flexing that wrist. Now, occasionally, you may want to pick up a wrist splint as well. That also helps immobilize the wrist and keeps you from using that wrist over and over again and irritating either side of those tendons. If you fail conservative measures, then definitely I would highly recommend that you be evaluated by an orthopedic specialist, preferably somebody that specializes in shoulder, elbows, and knees and has an experience of dealing with this type of problem. The good news is that this is a very common problem and most general orthopedists are familiar with treating this type of pathology.